I am juggling a few things, and the music ended earlier than I thought it would. I wasn't ready for it to be done. But welcome, everybody. So glad to have you here. Can everyone hear me okay, since I am now on my phone? A thumbs up. Are we okay? Yeah. Okay, awesome. Thank you so much. I appreciate that. Well, welcome to the Oregon Department of Human Services Self-Sufficiency Partners Meeting. We do offer ASL and Spanish interpretation. Please use the interpretation icon below to select how you would like to participate in our meeting today. We also offer CART transcription services, and there's some information about that in our chat. Self-Sufficiency Programs is committed to developing and deepening our partnerships to provide outstanding and culturally specific services and supports to the people in Oregon. This means listening, learning, and working together across ODHS programs and state agencies with the 9 tribes of Oregon, community-based organizations, and members of Oregon's communities. This virtual meeting occurs monthly and is a forum for updates, discussion, feedback, and Q&A about self-sufficiency programs and other related subject matter. This meeting is recorded so that we can share the meeting along with the presentations and minutes to those partners who are unable to join us today. And the follow-up email with all corresponding documents and links will be sent in about 1 week. At this time, we do ask that you introduce yourself in chat. Please include your name, pronouns, organization, and role. This is helpful to us and to partners for connection purposes. So I'm going to take a moment and do that myself right now. Today's agenda includes updates from our self-sufficiency director, family support and connections, and domestic violence survivor programs. Presenters, we do ask that you turn on your cameras while presenting where able, as our partners appreciate seeing the person who is speaking. Of course, we would also like to invite you to have your cameras on as well if you are comfortable in doing so. Up first, we have our Director of Self-Sufficiency Programs, and I see her on screen. Claire, I'm going to hand it over to you.
Hi, Misha. Thank you so much, everybody. My name is Claire Seguin. I'm the Director of Self-Sufficiency Programs. I use she, her pronouns. And I'm happy to be here today with a few updates. And I just want to also share one sort of sad experience that we're having at the agency. And I know some of you in the community are probably being touched by the stories that are coming out as well. But we have had one of our youth who has lost their life, and there are some news articles coming out about it. And I just want to be very I guess I just want to say out loud that we are all deeply affected. We are standing by each other with our families, with our employees who are grieving, and sharing some very, very tough conversations about our the kids that we care so deeply about, and the work that we do. And I guess I just felt the need to sort of share that out loud and let you all know that if we can be supportive of you and any of your partners or family, friends, anybody who is moved by this loss, please reach out to me and let me know how we can be supportive. This feels very much like a shared moment. When we all need to come together and think about how we're serving and what we're doing to support families and children in our system. So I think I'll just leave it there, but I just wanted you all to know that it's something that we are all dealing with here at the agency, and just wanted to share that with you. Okay, so what I really was here today to talk about in terms of what's happening in our work at SSP really has a lot to do with what's happening since last time I was able to chat with you all. And we were talking about our vision into action. And this is our bridge strategy to inspire our teams and our work in a direction where families are at the center. We're working better with communities. We're looking to wrap around families in new and different ways. And one of the things that's happened is that we have gotten to a place where we have individuals working on personal action plans as part of their regular sort of cycle of evaluating their work and making priorities around what they do in a day. And we're really excited to think about that. In July, each SSP employee has created their own plan, and they're included as a part of a quarterly management system that we already have in play. And so we're excited about everybody dipping their toe in this new water, helping work get focused, all pulling in the same direction to do more and better for families, as we all work on it together. And we're looking constantly to further define the role that family coaches play, working with our community partners and working with families and individuals to help achieve their goals. And the other thing that's super important right now to share with you all is that our eligibility services have almost fully transitioned into the eligibility partnership, the OEP program within the agency. So as all of that transition begins to come to a close, what it does is it then allows us to shine this brighter light on the SSP family coach work and all of that emphasis, so that together with the two divisions working side by side, we're able to really do the best possible work with and for the folks that we want to serve. So we're pretty excited about where we are and how we're moving forward. So I wanted to share a little bit of that success with you, and then we'll keep you posted how those personal action plans begin to make a difference in terms of what we're doing. On another slightly more serious topic, we've got a lot of wildfire activity. I know many of you are dealing with this individually and in your communities. And so I just wanted to share you a little bit of an update. I'm sure there's always more happening behind the scenes, but today I wanted to talk a little bit about some of the approved waivers that we've received from our federal food nutrition services partners that have to do with the 10-day timely reporting waiving so that folks can get replacement benefits. And what I wanted to say is that we've had to sort of manage our requests a little bit, but so far key details include for the fires that started around the 17th of July-ish, the counties that were affected with this particular waiver are Baker, Lynn, Malheur, and Umatilla. And the deadline is August 16th of 2024. So if we want to get the requirement for requesting of the placement of food purchasing with the SNAP benefits that are lost during the fire, we need to work on this by the 16th, right? The second big deadline is that the fires that started around the 22nd of July, counties affected, Crook, Grant, Gillum, Harney, Hood River, Morrow, Wasco, and Wheeler, the request deadline is August 21st. And I know that Jean and some other folks are on the call who probably have like real detailed answers. If anybody has any questions, we can answer those offline if you want, but just to give you a sense about the kind of timelines that we're working on for those particular groups of counties for replacement benefits. Just wanted you to have those in hand. Anybody have anything urgent you want to check in with the team on about that before I go on to the next thing? Okay, cool. The next thing I wanted to share with you all is that we've got kind of an interesting moment in time with the director of the agency, Fairmores Paksharest, is doing a whirlwind tour all across the state, meeting with not only our staff, but with partners in community. So I wanted to just share with you that so far he's already completed a tour to St. Helens. He's been to Salem. And then I'll give you the next three just to give you an idea about where he's headed next. So on August 20th, he'll be heading to Corvallis. On August 21st, he'll then head to Eugene. On the 22nd, he'll then head to Roseburg. So he's going to be doing sort of that little trip over 3 days. And it's really exciting because he is there to not only answer questions, of course, from community and from you all, but he's there to listen and share what's going on with the agency around budgets and all those sorts of things. Where's the agency headed? And then take your questions about all of that. So it's pretty exciting. And it's been a while since there's been a tour on this scale from the director. So we're excited to see him going around and listening and telling all at the same time. And then I think the last thing I wanted to talk about has to do a little bit with the summer EBT program. It has been amazingly successful. I know a lot of you know how hard it was to pull that program together in a hurry and get those dollars out the door. We did it for over 300,000 folks, and now we are still continuing to try to bring in all the folks who are still eligible by reaching out to them very specifically. Want to thank you all for the help that you're giving us trying to reach out to folks who might be eligible. The deadline is September 2nd, so we all just want to keep pushing, see if we can get those last 30,000 or so folks signed up for the program. So your help will be great. Your continued support is amazing. We also have our historic increase in the TADVS grant from 1,200 to 3,200. These amounts are going to be becoming available soon. Rumor has it maybe around the 11th or so. We're still hoping. We're trying to get everything rolling, but lots of more information will be coming about that. Very exciting. Again, I can't say enough how hard it is to get some of this work done in a hurry. And we've got teams who are just pulling it off. They're really doing an amazing job, and just want to give them some kudos publicly for the effort that it takes to take these new programs and new ideas and get the dollars out into the hands of folks that need them. So I want to appreciate them. And then the final thing on my list is just to share with you that we are continuing to send out educational tools and information to protect folks and their EBT cards. We know that the increases are happening all around us about how much skimming and fraud there is out there. It's a national trend. We're a part of a lot of conversations nationally about it. But on our end, we're doing the very best that we can to get the information out so that folks can do what they can to try to protect themselves. So we'll continue to keep sharing that information regularly. And if y'all have any feedback about what's working, what's not working, what you'd like to see more of, just let us know. I know you've got your ear to the ground on this and probably have some good ideas. So don't hesitate to let us know. There we have it. There are my updates. Any other questions or anything I can do for you? For the teams who are on, anything I didn't do right? Correct me if you need to. Oh, I see Beth. Hey, Beth.
Hi, thanks for that update there. Excuse me. I was just wondering if you could you say a tiny bit more about the skimming conversations that you're a part of nationally? We're also hearing a bunch about the federal, the program that allows, or that Oregon to participate in, that allows us to you to replace the skimmed benefits. It's gonna sunset. Am I too low? Hang on. Are you hearing through this better?
Oh yeah, that's good. That's what we need. And you might have to repeat the whole thing. I'm so sorry, Beth.
No, my apologies. Every single time I open Zoom or Teams, it does a different combination of microphone, and sorry. I was hoping you could say a little tiny bit more about what you're talking about nationally with the skimming issue, because I know that the federal funds that are designated to help
states replace the skimming benefits, that my understanding is that's going to sunset. And so I'm wondering if the state's coming up with any ideas for maybe the state stepping in to continue to replace skimmed benefits if it continues to happen, just because it seems like it's an ongoing problem. We haven't solved it yet.
Yeah, so two things that I can tell you. One is that when we just recently had the leadership from FNS come visit Oregon for a little bit, sort of just an in-person conversation. And there is a lot of very positive support for extending the benefits replacement. So we are not giving up pushing hard on that, just as an aside. So we're still trying to have that conversation, and we're providing the data that we can share and things like that to help sort of make that case. We're also working through our national advocacy group, the APHSA folks, to get them on board doing the work behind the scenes there. So it's not over yet. And we're a little bit more optimistic after this visit than maybe we had been before. But of course, you don't know, until that's all decided. I would also share with you that the national conversations we're having are everything from following California, doing some testing on the chip cards, to meeting with, high profile, maybe not high profile, but very highly skilled tech people about different protective strategies. I mean, everybody is talking about how fast the numbers are growing and how sort of scary it is from a technology standpoint. And the crime folks are very, very sophisticated, and it's very hard for the federal government to keep up with them, but it's pretty high profile. So there are a lot more hands on deck, if you will, to try to work on some problem solving. As far as an Oregon solution, we don't have one to replace the benefits at this point. And I guess I will open this up again to the team to see if they might be in a conversation that I'm not in right now, just to see if there's anything happening. But I do know that in addition to what might be happening sort of more informally, we are reporting this information out regularly to the governor's office and our regular reporting, just to make sure that there is a good, solid awareness of what's happening trend-wise, especially. But we don't have an easy answer and don't have a dedicated funding source at this point outside of, whatever the feds are going to provide.
Okay, I appreciate the update, and I'm going to try to take some of your optimism and apply it to also on that. But then just maybe for you, Claire, and Misha too, maybe we could keep getting updates on that
Sure.
in this meeting, because I'm just a little worried about what's going to happen federally, and then what Oregonians will be left with.
Yeah, I appreciate that for sure. Anybody else have anything? All right. Well, it's nice to see you all. Thank you very much. Thanks, Misha.
Thank you, Claire. All right. If there are any further questions for Claire, you think of another one after the fact, please feel free to put those in chat and we will be happy to get back to you. Up next, we have Tony Scott from Family Support and Connections to talk to you a little bit about that program. Tony, are you here?
I am here. Can you hear me?
Yes, thank you.
Great. Hello, everybody. My name is Anthony Scott. Everybody calls me Tony. You can call me either. It's fine. I'm with SSP's Family Support and Connections. We are a child abuse and neglect prevention program operated out of self-sufficiency as opposed to maybe a child welfare. That's kind of the cutoff for us. Prevention, we're looking to try to cut it off at the pass, so to speak, and try to address those things that lead to child abuse and neglect. Once a family gets involved with child welfare, we're kind of out. But we contract with local partners. We have at least one partner in every district throughout Oregon, throughout the state of Oregon, that we can refer individuals to, either through our link on the internet, through our website, or through maybe a local storefront office, to help families address some of the root causes of child abuse and neglect. And one of those things would happen to be financial stressors. And so we have our providers have budgeted a certain amount of money, which we call flex funding, to help families address financial needs if they can't find local resources. For example, maybe some utility payments, or maybe diapers, or almost anything. So we do have that available for Oregonians to take advantage of, and so we wanted to put that out there for everybody who has is serving the public, and you think maybe that would be a great resource for some of the people that you're serving. That would be great. That's kind of it in a nutshell. It's a fairly it's a great program. I'm new to the program. Forgive me. I've been with the program for about 1 year, finding out wonderful things about it. So, does anybody have any questions about family support and connections? Maybe I went through it a little too fast. No. It was for a long time. It was only for TANF participants. People who were receiving TANF would be eligible, but recently, I believe it was the last long session, helped fund increase the funding, and so we were able to increase the income limits to serve not just TANF individuals who are receiving, but people who are potentially eligible for TANF down the road. It's up to 300% of the federal poverty level, which is quite high. All you have to do is have a child under the age of 18, live in Oregon, and not be working with child welfare. And so, thank you, Misha, for putting that in the in the chat. Please remember Family Support Connections in the future. And if you're working with a local self-sufficiency office, talk with them about Family Support and Connections, and how that organization is working with their with people in self-sufficiency, and get a little more information, because it's not always the same organization throughout the state. We have everything from counseling organizations to community action agencies to special education districts that are working with Family Support and Connections. Yes, Laura.
Hi, and I'm my attention is split, so I'm sorry if I missed
No problem.
something, but
Sure.
I've been trying to learn more about how I can help folks connect to the Flex Request funds for things like rent or whatever they're short on, and I feel like I'm hearing back mixed results from folks. So, for example, I just had someone who asked their doctor for help with the Flex Request funds, and the doctor responded that that's only for the like climate related stuff, like to get the air
Sure.
conditioning. And my understanding is that there's a separate Flex Request fund. So,
Sure.
I guess, do you have any tips for how I can actually help make
Okay.
sure that folks get that referral?
Okay. So funny you should say this. In my role previous, I was the state refugee health coordinator, because the question that you're asking is something that is not related to Family Support and Connections, and the flex funds are separate. But I can try to help you with that. So CCOs have funding available called flex funding to address those particular things. Each CCO is going to have a different process. So I don't know where you're located. Where are you located?
Multnomah County.
Multnomah County. Okay, so we're talking Health Share and Trillium, right?
Yes.
So okay, so what you're going to want to do is, and my suggestion is to reach out to each CCO to ask about their flex funding process. Some make it a little bit easier. Some have a little bit more red tape. And so what I would do is I would talk to them, so that when you're dealing with an individual who's covered under Health Share, and even under Health Share, they have multiple organizations working with them, like Care Oregon, Providence, and whatnot. Trillium, they're going to have their own process too. And in my experience, there's a lot of hoops that you have to go over and go through and fill out documents to make sure that there is a one-to-one connection, that this is a medically related to touch those flex funds. That's what I can give you. It's not related to my program, because we call our funding also flex funding, but it might also be that might be a good referral to Family Support Connections, because it's not just about the flex funding. It's about it at the heart of it. The Family Support Connections program is a home visiting program. People call and we go into people's homes, and it's all voluntary. We don't storm through, but it's like, hey, they make a connection. Hey, we want to come over. We want to introduce ourselves and try to work with each family to address the needs that are happening. And sometimes it might be medical related. And so the flex funding that we have in Family Support Connections can't be used for anything that's covered by Medicaid, but if it's not covered by Medicaid, it's certainly negotiable. So that's something to keep in mind as they try to work on family goals to try to address the issues and the stressors that's hitting that family to help prevent child abuse in the future. Did that kind of get to where you were needing to go, Laura? At least on the CCO side?
Yeah, that's helpful. Sorry, there's too many flex fundings.
Granted, I'll give it to you. It seems to be the term that everybody's using for cash or funding that we have that we can give out to people because it has that flexibility.
Mm-hmm.
I apologize if there was a confusion. But again, with the CCO, you're going to want to reach out to them directly because each one is going to have, like I said, they're going to have their own process. And that's something that we've dealt with before, or I've dealt with before. And any kind of relationship that you can develop with their customer service, with their patient relations people, anytime you can build that relationship, that's a good relationship to have, because then you can go directly to that person and say, hey, we've got this, one of your members, and they have this issue. And then they're talking.
Yeah, thank you. And I actually have called the CCO, or one of them, and
mm-hmm.
they just gave me the list of health insurance providers. So and told me to reach out to them.
Okay,
so I don't know if you recommend, if there's specific contacts you recommend, or.
Well, that sounds like health share, because health share
Mm-hmm.
is kind of an overall that works with a handful of different health insurance companies like Care Oregon. So that you're going to want to, of course, go through all the procedures in order to make sure that you have releases of information like that to work with that individual, and then reach out to that specific company. For example, Care Oregon. You're going to want to have that and reach out to them specifically. There's no shortcut, as I've found. They're very protective of that money to make sure that it's being done correctly. But I know that they want to spend it. I know that they want to find places to put that money, but it's just hoops.
Great, thank you, and thanks, Heather.
Is there anything else? Oh, looks like there was a question. How does a family find out or connect to this resource? Very good question. What you can do is go to the Family Support Connections link that is in the chat. Thank you very much, Misha. Click on that, and there's a online referral form. You just fill it out. You can fill it out on behalf of somebody, or you can if you're working with an individual, say, here, go ahead and fill this out. There's very little required information. You just put it in and hit submit, and then somebody will reach out to them. Or you can submit it on behalf. We have received referrals. Hey, I have this person in my life that, the husband left and she's stressed and yada, yada, yada. And they submit it, and the organization will then reach out to them and say, hey, somebody submitted your name and we want to, is there something we need to help? They'll start the conversation from there. You can also go to a local storefront office and talk about if they have a TANF family coach that they're involved with. You can connect with them to have them do a referral, because a lot of our family support connection contractors have good relationships with family coaches because of the eligibility requirements from years ago. And so those are a couple ways that you can do it. Or if you find out who the contractor is, you just contact them directly and say, I'm interested in services for FS&C. Cool. All right. That's Family Support Connection.
Did you see all of the question that Gabby had?
Oh, let me see if I can come down here.
Families don't necessarily have to receive SNAP, TANF, or OHP for this program, correct?
Correct. Sorry, I had to scroll down on my chat. I thought I was already at the bottom. No, they don't have to be eligible. They don't have to be receiving it. eligibility is you have to have a child under the age of 18 living in your home. So it's because it's all about child abuse prevention and neglect. You have to be living in Oregon. You're an Oregon resident. Have under 300% of the federal poverty level, and not have an open child welfare case. That's the only eligibility requirement. So if you have somebody that meets those requirements, feel free to make a referral. And let me see here.
Beth had a follow-up question. She's got her hand up as well.
Okay, go ahead. Go ahead, Beth.
Thanks. I have two quick questions. One is, is there any requirement that you have exhausted all of your other options? Like, for example, if somebody's enrolled in the IDD program, they might have access to similar supports, but maybe whatever, either they've already gotten them or they haven't asked for them. Are you asking folks to exhaust their other resources first?
No, not necessarily. What will happen is the family advocate, and now each organization has their own title, but most people call them family advocates, will work with them. That's part of the process, is sitting, okay, let's say, for example, you need help with housing assistance. It isn't just a let's cut you a check situation. It is more of a hand-holding. Let's talk about the resources that are available in the area, trying to help them work through the process. And if they get to the point where they've exhausted, it's like, yeah, okay, we have this funding that we can use to help you. So it isn't necessarily come in, cut a check. It's really about a process of problem solving, case management. That's kind of the heart of it. But there is not necessarily you have to exhaust everything and then provide proof and get a note from your doctor or something like that. It's but they do want to help. What are the options out in the community? Have you tried everything? Because family, as with all resources, it's limited. We can only do so much, and so then you have to start tapping into other resources if a problem continues, because we can't help for more than 4 months. That's the maximum that we can give in terms of flex funding. The services can last much longer, but the actual we can help with rent cannot exceed a certain amount of time. So there's definitely a sitting down and talking and working through the resources.
I guess I'm just like flagging the fact that there are some other resources, and I think flex services are still in this category where they do want to know that you don't have anything else available, like the resources aren't available through. So I'm a little worried about there being like a standoff, like each source that you would go to for some help would say, well, I think you can get it from them, so we're not going to give it to you. But the other one saying, no, I think you can get it from them, so we're not going to give it to you. Meanwhile, eviction notices are starting to be issued.
Many years ago, when I was a caseworker in one of the Salem branches, that's kind of what you run into, is like, well, I'm not going to pay, so you need to go down to the housing department. Housing is going to pay until TANF. I know exactly what you're talking about, and we try to avoid that, but we're not going to require somebody going to, like all of a sudden they're in late status or something. It's really about how you can pick, and not necessarily pick and choose, but how can I engage the resources that are available so that I'm just not limited to family support and connections. It's really looking at a broad spectrum of resources.
Okay. And then the last question is, like, if somebody does an application for these services or help with rent, and they're denied, is that something that they have a right to a hearing regarding?
No, not at this particular point. These are services and not a benefit program. There's not assistance, if that makes sense. I don't think I've ever heard of anybody being denied of a payment as well. That just doesn't really happen. People may apply and they're not eligible because they don't have a child, but that's a different scenario. I suppose they're not willing to pay for a particular thing. Does that get to where you need to be? Answer anything?
Okay. I'm surprised at that answer, but yeah.
Well, as it currently stands now, there are no hearing rights for this particular program. Okay. Says we need more robust advertising for SSP benefits. Agreed. Definitely agreed. It does. There's a question. Can it help cover PG bills? Yeah. Yes, it can. Are there any other questions here that someone sees that I haven't been able to get to, or I accidentally skipped? Well, thank you everybody for your time, and please feel free to reach out if you have any other follow-up questions or you want to know. I'd be happy to have a chat. Thank you, everybody.
Thanks, Tony. I'll put together some information in our follow-up with some different brochures that we have in a couple of different languages. I did put a link that I was able to find quickly into chat, but we do have those in some other languages so that you have them and can share them with families that you think this could be helpful for, because it can be an internal referral, but they can also self-refer themselves for this program, or there's a couple of versions underneath this program, if I understand correctly, and there's one you can self-refer to. So I think that we might have to have family support and connections come back and present more, and even in more depth, because I can tell there's some questions and there's some real interest today, which is awesome. And we definitely want you to have the information that you need so that you can be familiar with this and help families learn about it. Annie, did you have a question?
Oh, well, I was just curious. Again, I hadn't heard of this. This is amazing. I'm really curious about like funding and things, but can we share this really widely and feel confident that folks who are eligible will receive services, or is there a waiting list?
Yeah.
I'm just curious about this, the capacity.
Yeah, no, we recently added a couple. We do have in Multnomah County, there was a short waiting list with LifeWorks Northwest, which is one of our main contractors in the Portland area. We just added 2 more, Family United and Skill Builders. So they're helping to address any wait lists. But I haven't heard of any wait lists throughout the state. There is at least 1 contractor per district. And one of the things that we've been talking with them about is how they can do outreach and marketing in order to get to reach their goals. So I don't know of many organizations that are maxing out except for LifeWorks, but that's only because, hiring issues. So there is no immigrant requirement or immigration status requirement at this time. And that was asked by Beth. That's correct. And if I'm saying the name correctly, Farron?
Yeah, that's correct. Hi.
Hi.
I'm curious if there are any plans or maybe things already in progress toward including basic info about this program, this whole department, within things like SNAP and OHP eligibility letters, or even building it in as a normal expectation of what eligibility workers speak with families about when they have like SNAP eligibility interviews, for example. I say that because there was a long period of time in which I, as a mom, was receiving benefits through SSP.
Right. Mm-hmm.
And now I work at a community college and I help people apply for those things. And I've just never heard of this until today, which is such a shame, because it sounds like a wonderful resource. And the income maximums are higher even than they are for SNAP. So there's so many families that could benefit from it. And I think it's probably very, I think there's a very low level of awareness about it. And I'd like to do my little bit in changing that.
No,
so I'm curious how you guys
I hear you. I hear you, and that's kind of been on my mind. And my colleague Tina, we've been thinking about how we can get the word out. It was a very small program for many years. It was really, you had to meet TANF eligibility. You actually had to be on TANF.
That's right. How long ago did that change?
At the beginning of the biennium. Actually, in a few months into the
Oh gosh, so the expansion is really only about a year now.
Yeah, I mean, we're hitting the 2nd full year come July, right? And so there was some capacity buildup that needed to happen within the program, working with our community partners, working with the contractors, trying to kind of get them to more of a, hey, let's start looking at doing more outreach. Tina and myself, we've been doing some. We spoke at one of the SNAP eligibility all staffs and tried to get the word out there a little bit more. We're trying to do what we can internally, and I have been thinking about, hey, how can we get some kind of word out to people who are applying or getting notices, who are getting benefits, that this is an option for them. That has been on the table, and how we can do that. So, but I appreciate the encouragement, and Could take some time, but that's something that's on the table.
as someone who spends all day working with basically 20 to 30 somethings, and the ones who are parents, you gotta be really good in your social media advertising game. I know we still don't think of those spaces as needing to be tied to governmental services advertising, but they totally do.
Yep. Completely agree. I totally hear you. Our first line was to work with the partners and say, hey, you guys, get out in the community, go to community meetings. They didn't have to do that before because they just got their referrals. And so this is kind of a new world for them. It's like, well, where are we going to get our referrals? Well, you need to go out and go to the local schools and school districts and community meetings and just kind of get your name out there and get the program out there. So we're all trying to do a little bit. But I think anywhere that we can emphasize this program or get the word out there through automatic mailers within ODHS is good work. So I will definitely be looking into that. And that's, like I said, that's been in the back of my mind for a while.
Thanks so much, Tony. I hope that this
No
didn't
problem.
feel like unkind criticism. It's
No.
more, oh my gosh, this exists and nobody knows about it. That's got to change.
No, I think it's definitely needed. I just want to let you know I hear you, and that's I've already been thinking about that and how we can do it. It's usually just a logistics issue at that particular point, and sometimes getting things changed and notices changed, which is a little inside baseball. It takes a little bit of time, but it's definitely something to be thought about and put on the list of things to do. So thank you for that encouragement. Appreciate it.
The summer EBT folks have done a really great job coordinating with school districts to get the word out to parents about the availability of that program. And I see a huge potential for your department to partner with school districts for that kind of advertising as well.
Oh yeah. That's a good idea.
Too late at this point for that to be in like back to school information this year, but that's probably an opportunity for future years when students are thinking about school again and parents are thinking about how stressed out they've been over the summer with their kids home.
Yeah.
And all of those things.
Well, and I don't think summer EBT is going anywhere. Summer will be here again next year. So it's definitely something to consider for the future. So thank you. Appreciate that.
All right. There may be some more comments. If you have more comments or questions, please feel free to put them in chat and we will try to get them addressed. But I know that our next presenter is ready and has some really important information for you. So I want to hand it over to them, but really quick, just to clarify with regards to this program, I think one of the reasons that maybe it's hard to advertise is because each area has a different partner that is providing these services for us that we're working with, different contracted partners. And so I would really recommend, if you know your community partnership coordinators, I will help you connect with them. If you need that information, they can help you know which partners are providing the FSNC or that Family Support and Connections program within the community. Because it's different community to community, it's not something that like a blanket statement, it can really address very well. But I just want to throw that out there. And then I'm going to hand it over to Chelsea because I know that she is waiting so patiently to talk about some really important updates here. So I'm going to hand it over to Chelsea right now.
Thank you, Misha. And I've got Brittany sharing. We were going to do a little, I know we're short on time, so I'm going to go through this kind of quick. Just because we want to make sure that we share all the information with you. I'm Chelsea Goldberg, she, her pronouns. I am with the Domestic Violence Survivor Programs team with ODHS. And so we are in the self-sufficiency area of the agency, and Brittany Zitzelberger is also on my team. She's here presenting. So we are excited to announce that our agency has received an investment to increase the grant amount for the Temporary Assistance for Domestic Violence Survivors program, also known as TADBS. If you're unfamiliar with that program, we can briefly go over kind of what the program is, but we do want to say that the grant amount has increased from $1,200 to $3,200. That will be effective on August 11th. I know Claire kind of touched on this when she was talking earlier. It will be effective August 11th, which is really exciting. And any survivor who has an open and active case at that time will receive that increase. And then, of course, anybody who applies on or after the 11th. The 11th is a Sunday, so we just anticipate that Monday will be the day that everything goes into effect. So just a few more days, and we're really excited. This is the first time it's had an increase since 1997 or 96, 26 years ago. So we're really excited to offer, more valuable potential, dollar amount to survivors. We've undergone all the system updates, rule changes to allow for this. So I can go over real quickly kind of really what TADBS is for those of you who may not know, and then we'll kind of go over some resources and FAQ type of things. So it is a TANF funded, so Temporary Assistance for Needy Families, TANF funded program. Intended to provide temporary financial assistance and support to families affected by domestic violence. It's used to address safety concerns relating to the DV and is used most often when fleeing or to stabilize living situations away from the DV situation. Some other pieces, some eligibility factors. So they do have to meet TANF eligibility requirements, including but not limited to the following here: living in Oregon, so an Oregon resident, have a caretaker, relative, and dependent child. So that's one of the big pieces related to TANF. TADBS financial eligibility uses net available income. So we can consider a lot of deductions. We do use the TANF income limit, but it's definitely different than using the gross income. So we look at a lot of deductions, and there must be a current or future DV safety concern. And then we have a definition, the SSP definition of DV that must be met. So the definition that we utilize for our program is domestic violence is the occurrence of one or more of the following acts between family members, intimate partners, household members. So remembering those three key relationship pieces there. And then we are looking at, physical, emotional, mental, or verbal abuse, or placing another in fear of imminent serious physical injury. So, threats, those kinds of things, committing sexual abuse, or using coercive or controlling behavior. And our staff are well-versed in those pieces, but just know it's a little bit different than you might see maybe from community-based organizations that support domestic violence. But many of the factors are the same. And then we can move on to how someone can apply and how it works. So a survivor can apply using our application for benefits. It's the 415F form. If you're familiar with ODHS programs and self-sufficiency, it's that same form for services, or by calling an ODHS office. So these intakes and applications can be done by phone for TADBS. We do determine eligibility within 16 working hours, as long as it's safe for the survivor to do so. And then it is a 90-day certification period because it is considered an emergency program. And then the survivor will create a safety plan, and all payments will align and support that safety plan as long as they're allowable within our rule. And they can receive up to $3,200 to support the safety plan, which we're really excited about. We think that will go a lot further, especially for those who are wanting to move into new housing. $1,200 really wasn't a big support. And so really hoping that this is much more supportive to those who have higher costs, higher safety costs.
Just wanted to add one piece, Chelsea,
yeah.
for folks here, that many of our programs can be applied for online. And I just wanted to note that TADBS cannot be applied for through our one applicant portal. So folks do have to either complete an application for benefits or just make a phone call and we can do that. It's really intended due to confidentiality and safety. It's not in our applicant portals. just wanted to call out for folks here that you won't find the application online, phone, or the paper application.
Yes. So again, I kind of touched on it earlier, but we did change our OAR to align with the new allotment, and then also changed our one system to allow that. So that will be available on 8/11. And then really important to know that there are no other changes to the program except for this amount. So we're not changing eligibility requirements. We're not changing how survivors access TADVS. We're not changing any other piece of the program except for an increase in that grant amount that is available. Family coaches will be connecting with survivors, and notices may be sent out. They'll be notified on August 11th or after August 11th about the potential increase, but many family coaches are already working with survivors to let them know ahead of time, especially if they have an open case. And then again, any survivors can reapply after their 90th day. So if they continue to have safety concerns, or they have applied in the past and the $1,200 didn't meet, or they just couldn't complete their safety plan for whatever reason, they're always eligible, or not eligible, but they always can apply for TADVS multiple times if they need to. So, and we will be monitoring how those funds are utilized. We'll be using a lot of data. We will probably be doing some community engagement and those kinds of things to really determine how this is impacting survivors, so we can hopefully continue this funding as a permanent funding source. And then Brittany put in the chat, there's an FAQ document that I think will be really helpful to partners. There is a flyer. So there's a link to a flyer, and it's available in several languages. And I will also be sending a couple documents, the PowerPoint and links and a document with other links to Misha to include in the minutes. But anyway, those two documents I think will be really helpful for external partners. Posting a flyer, it doesn't indicate anything about the 3,200, but it is just in general awareness about the program. And we really hope that this increased grant amount will help survivors a lot more here in the future, very near future.
I wanted to note for the flyer, you can print it from our form server. We had it made in like an 8x11, so it's not strange, large paper, and it can be printed in color. That's great. Or it's also printable in black and white and works and looks just as great. So if you want to use it or have questions, please feel free to do so. The FAQ link that's shared there, there should be a link to the flyer. That's the English version. And then in the FAQ starting, we're working on getting the external FAQ link updated with additional questions and rollout information. So the link is correct and it will be updated in a couple of days. It will also have links to all of the 9 languages that the flyer is also translated in. So if you have, a specific translation need in the community, there's 9 available languages for the flyer as well.
Yeah, there's a link for that flyer. It's called Everyone Deserves to Be Safe. It is in the chat and you will receive it in minutes as well. There was something I was going to say, but I can't remember. Beth mentioned that people can get TADVS even if they don't have immigration status. Yeah, so there are situations that we can waive the requirement to be, the citizenship status requirement if there is a domestic violence safety concern. So just know that is a piece of the program as well.
And that will be in the external FAQ as well. So thanks for mentioning that. We'll also make sure it's documented in there for y'all to share that information.
Yeah, I know we're very close to time, so I'm going to wrap it up there. But yeah, so we'll hopefully you all can help us get the word out to survivors who are needing this type of funding for their safety plan.
All right. Thank you so much, both of you, for telling us about this. This is really very exciting that we're able to offer this increase. So very exciting for sure. we are at the end of our meeting today. But if you do have questions or need a little more information, please feel free to reach out to me directly. You can put them in chat, or you can just hang out for a minute and I will stay on the meeting if anybody has anything that they'd like to ask more about. So thank you so much for being here today, and we'll see you again in September.